Hello friends, welcome to BusyMath channel. In this video, I am going to explain you about the rheumatoid arthritis. Rheumatoid arthritis definition and pathogenesis. Definition is, in rheumatoid arthritis, it is an autoimmune condition. So in this, inflammation of joints will be occurring, leading to the painful and swelling joints. So inflammation is occurring and that will be lead to the swelling of the joints and painful joint and induces the formation of pannus. Pannus is nothing but it is a proliferative granulation tissue which erodes the articular cartilage. Means in rheumatoid arthritis, it is a erosion arthritis because here the erosion of the articular cartilage is occurring. The predisposing factors in rheumatoid arthritis is it mainly occurs mostly in females and HLA-DR4 gene is involved. Tobacco smoking is the risk factor. Rheumatoid factor is present. Rheumatoid factor is IgM antibody that targets against the IgG-Fc region in 80% individuals. Anticyclic citrullinated peptide antibody is present. More specific antibody is anticyclic citrullinated peptide. Now coming to the presentation and clinical features of rheumatoid arthritis. So the joints which are involved in rheumatoid arthritis is PIP joint and MCP, that is proximal interphalangeal joint and metacarpophalangeal joint are involved. Distal interphalangeal joint is not involved in rheumatoid arthritis. Wrist is involved. These joints are painful and tender, bilaterally symmetrical, and morning stiffness is present, which be there or last for more than 1 hour in rheumatoid arthritis. So this is the presentation of the patient. Now coming to the symptoms, physical activity decreases. If less than 4 joints are involved, then it is oligoarticular. If more than 5 joints are involved, then it is a polyarticular. Flexor tenosynovitis is present, which is a hallmark feature, that is the movement will decrease. There is a decreased range of movement, decreased grip strength, and decreased trigger fingers is present in rheumatoid arthritis. So this is the signs and symptoms of rheumatoid arthritis. Now coming to the joint findings and deformities which are associated with rheumatoid arthritis. So erosions will be occurring, as we earlier see that there is erosion of the articular cartilage. Juxta-articular osteopenia is present. Swelling is present because of the inflammation. Subchondral cyst will be present and joint space narrowing will be present. Now coming to the deformities which are associated with the rheumatoid arthritis. First deformity is cervical subluxation, that is atlantoaxial dislocation is occurring, which will be leading to the compressive myelopathy and result in quadriplegia. That is because of the atlantoaxial dislocation, there is a compression of the spinal cord and that will be leading to the paralysis of all the 4 limbs, that is quadriplegia. Okay. Now coming to the hand signs classification, mainly classic hand signs which are seen in this rheumatoid arthritis. Ulnar deviation is seen, boutonniere deformity is seen, swan neck deformity is seen, Z-shaped thumb is seen, and metacarpophalangeal subluxation is seen. So in swan neck deformity, what is happening is there is a extension of the proximal interphalangeal joint and flexion of the distal interphalangeal joint. So this is a swan neck deformity, and boutonniere deformity is opposite of swan neck deformity, that is there is flexion of the proximal interphalangeal joint and extension of the distal interphalangeal joint. And mallet finger is hyperflexion of the proximal distal interphalangeal joint. Hyperflexion is the mallet finger. Okay. So the deformities which are associated with the rheumatoid arthritis is ulnar subluxation, metacarpophalangeal subluxation, and swan neck deformity, boutonniere deformity is seen in the rheumatoid arthritis. So what is swan-like deformity? It is the flexion of the distal interphalangeal joint and hyperextension of the proximal interphalangeal joint. Buttonwood deformity is opposite of swan-like, that is hyperextension of distal interphalangeal joint and flexion of the proximal interphalangeal joint. Ulnar deviation of the metacarpopharyngeal joint, the fingers are deviating toward the ulnar bone at the metacarpopharyngeal joint. So these are the deformities associated with the rheumatoid arthritis. And in the next video, I am going to discuss about the extra-articular manifestations of the rheumatoid arthritis